Health is everyone's business. Doctor's Appointment educates in ways we can all understand, encouraging and promoting a healthy lifestyle. Brought to you by Maverick Communications, NCB Insurance Procare, NCB, Gleaner, Star, Singer, Spanish Court Hotel, Flirt Boutique, and Express Fitness. Aired exclusively on TVJ.
According to the World Health Organization, stroke is the second leading cause of death in Jamaica. Today, we talk about stroke, its causes, effects, and treatment. But first, we take it to the streets with our Vox Pop.
Well, I know that when you get stroke, your mouth twists, it make one side of your body dead and you can't move. And I know say it can kill you, something can kill you. You understand? I know say you can have it more than one time.
You have to eat right and maintain your pressure. Don't let it get too high, so that your blood pressure go high and your vessels burst or something.
Also regular exercise as well, reduce fatty foods to prevent blood clot stroke.
I don't say cripple either to the right side or the left side, but especially normally take the left side.
Joining us today is consultant interventional neuroradiologist at the University Hospital of the West Indies, Dr. Peter Johnson. Thanks for joining us, Dr. Johnson.
My pleasure, Sarah.
Boy, I know a lot of people are wondering, interventional radiologist, what he has to do about stroke or what does he know? But before we get there, let's just go to the basics. What is stroke?
So stroke is essentially an acute or sudden dysfunction of the brain. And it's typically as a result of blockage or some other disease happening to the blood vessels that supply the brain. You can get bleeding both into the brain tissue, which is called an intraparenchymal bleed, or bleeding around the brain, which is called a subarachnoid hemorrhage. All three types are considered stroke. Now, in terms of neurointervention, we've been treating things like aneurysms, which are abnormalities in the blood vessels where they bulge out, they form a weakness in the wall, and they cause rupture, one of the causes of stroke. And we've been doing this for over 20 years. So if we are going up into the blood vessels from a little puncture in the groin to block up the blood vessels, then why not send up something up there to take the clot out? And that has been something that's been in development for the past, say, 5-6 years. And coming out of some important trials last year, that method of treatment where you send a little device up into the blood vessel and retrieve the clot in a certain subset of stroke has proved to be very useful and beneficial and has now become part of the care, the tools for care for stroke.
And this is cutting edge. You actually did a neurovascular fellowship at Western University in London, Ontario. So, and you're the only one in Jamaica that does this. So what is it that the person should look out for? And when should they say to themselves, okay, I need to go to the hospital now?
Okay, so the symptoms of stroke are variable. But your right side of your brain controls the left side of your body and vice versa. So if you have a blockage in the vessel going on the right side, you'll find that the left side of your body may become weak depending on which part of the brain is involved. Your face will start to feel a little twisted, and the patients often have difficulty speaking. They'll have slurred speech or sometimes not be able to say anything at all. Sometimes, depending on the nature of the stroke, they may be totally obtunded, meaning that they'll lose consciousness or they'll be confused. Anything that will affect the normal function or brain function, right, should be considered a possible stroke. And when that happens, it's important to get to a hospital that can manage these sort of things right away, because time is brain. And what I mean by that is that if you're able to open up that clot, for example, or the blockage that is occurring in the vessel, if you're able to do that within a certain period of time, and we now know within 3.5 hours from the onset of symptoms, we could potentially open up back the blood flow and your entire symptoms may be totally reversible.
But is there anything that would be beneficial, like taking aspirin or so, while the patient is getting prepared or on the way to the hospital?
Well, Sarah, just to remind you that time is brain. So once you've recognized any of those symptoms which you had outlined, it is very important to get the patient to hospital where the best proven therapy is available, which is reperfusion treatment, which I mentioned before about getting the clot out. Anything else that you would do, even if it were of moderate benefit, is just going to eat up time. You remember now you have to get the patient from wherever you are to the hospital through traffic and the rest of those things which can add to that time, and you only have 3.5 hours between the onset of the symptoms and when you're able to give that drug safely and for it to have proven benefit. If you're going to go to your general practitioner or to a clinic, etc., what they're going to end up doing is sending you to the hospital. So that is an extra route that you're going to take, which will eat up time.
Okay, so once this person is at the hospital now, what should they expect?
Okay, so when they get to a hospital that has a stroke service, essentially what happens is a so-called stroke code is set off, and a bunch of people who are involved in the stroke service are alerted, and this includes emergency services, so the emergency room, which includes their doctors and their nurses, the neurologists, the neurosurgeons, and the radiologists who may be involved. So when they get there, you are immediately seen by the doctors in the emergency room, and you're assessed quickly to make sure you're stable, etc., and whether or not you do have a stroke. If that is thought to be the case and you're stable, you're taken right away to the CT scan, and a special test called a non-contrast CT scan of the brain has been shown to be the best test. And we have had this in Jamaica from way before I started my residence in 2001. So it's available, and there are many places that have CT.
And this non-contrast CT scan will confirm a stroke?
Well, what it does two things. It may confirm that it may confirm a stroke, but more importantly is that it will exclude bleeding into the brain, because once you've had any form of bleeding into the brain, it's a contraindication to you getting the drug.
Okay. All right, so after we do the CT, what's the next team to get involved, or what's the next step?
So essentially what happens in many places is that everybody's on hand. So it's not as if you're seen by a doctor in emergency, then
so
they
it's
go
happening at the
somewhere
same
else.
time.
Exactly. So they generally, the stroke team moves with you to the CT scanner. And very often, once it is said that, okay, this is a go, you're a patient, you're a candidate basically for the therapy, you can start it right away.
It's done right there.
It can be done.
Many people don't know that stroke can be cured. So this is something that people really need to be aware of, and we'd love if you'd explain it in detail.
Okay, so just to clarify, the administration or giving of that drug, TPA or tissue plasminogen activator, that has been in place since 1995, and it has been pretty useful in treating most stroke in the acute phase. But what we've found is that depending on where the clot is, so if you think about back to the same plumbing example,
Analogy, yeah.
You have the big pipe that comes in and then it branches off into smaller pipes which go wherever they're going. The same thing happens in the body with the blood vessels. So if the blockage is in one of the big pipes, so for example the internal carotid artery, which is one of the main arteries that goes inside the brain, if it's there, usually the clot is very extensive, it's a long clot. And the drug that we're talking about, TPA, it's basically an enzyme, and it takes some time for the drug to pretty much eat up that clot, right? So while it is taking its time to eat up the clot, the brain is dying. So what we've found is that if you're able to actually pull the clot out, if you're able to do that, then maybe you'd have better outcomes. And a bunch of trials came out last year that validated this method, and it uses a special device predominantly called a stent retriever. For a better word, it looks like a tubular piece of mesh that you deploy into the clot. It opens up into the clot, basically incorporating itself into the clot. And using those x-rays all the time, I then pull it back into a special tube. And then once I've pulled it back and made sure no clots got broken off, I do what's called an angiogram or a special dye test to make sure the vessels are nice and open. And then that's that. And it has been shown to be very useful for this particular type of clot.
Okay, so after this procedure, and you say it's curative, what about the deficits that's resulted from the actual stroke? Does it need a lot of rehabilitation, or is it instantaneous that because this person has weakness on one side, slurred speech, other may be confused and disoriented? Do you find that once this procedure is done, most of these things return immediately?
So one of the most amazing things about both the TPA treatment as well as this clot retrieval treatment is that it's almost magical when you look at the patient who comes in. One side is completely weak, they cannot speak, they're often very confused, terrified, etc. And within minutes, they start to return almost completely back to normal when it works perfectly.
Right.
And they are the most appreciative, happy people you'll ever find. Everything comes back completely to normal in many of these patients.
Prevention is better than cure, right? So we know that there are these wonderful, plausible options for once you're a candidate for curing the stroke. But what are things that people can do now to help them not get in this situation?
Well, the common causes of stroke, all types of stroke, the commonest ones are lifestyle. So your diet, high cholesterol diet, anything that's going to make you obese or elevate your cholesterol levels, put you at increased risk of stroke. So obviously proper diet and exercise, very important. If you are hypertensive, ensure that that is controlled, so you stick with whatever antihypertensive regimen that your doctor has put you on. Diabetes is a major problem, so again making sure that your diabetes is under control. Cigarette smoking is a big factor, so just never smoke, right? There
more
is
reasons than one.
exactly,
Yeah.
and then there are a whole bunch of other diseases that are there that are risk factors, and again optimizing the control of those would be important.
Okay, thank you very much, Dr. Johnson. We're going to speak back with you with actually one of your very patients that went through this entire procedure.
Today's health tip is brought to you by water. Drink more water. Studies show that people who have suffered a stroke can reduce the risk of further stroke by keeping hydrated.
Thanks for watching Doctor's Appointment. See you after the break.
I was diagnosed with breast cancer in 2002. I was 19. I had to remove the cancer. I was okay for a couple of years, then the cancer come back. This time it was more aggressive. I had a stroke, then I lost my sight. Then I just keep having these seizures. It was so hard. It was hard for me to go leave my child. He's everything to me. Cancer is not easy. I know I had to live. I know I just had to live. Financially, it was extremely hard. My husband and I, we have to sell the car. Family and friends pooling their resources to assist. It is really hard without an insurance. I am encouraging everybody to get an insurance. With an insurance, you are covered. We must get an insurance.
Not quite there yet. Now we're getting somewhere. This will put some pressure on it. Almost there. And just like that, 2.4 liters of water lost. So why not put back what you lose? Optimal dosage, 4 bottles for women and 5 for men. Don't just look at me, you're losing it as we speak. 4 a day, the water way.
Don't be a New Year's resolutionist. Check out our Start Now program. Start working on the body you want today. No, the body that you deserve. Start now for only $29.95 at Express Fitness 24/7. Your goal is our mission.
Welcome back to Doctor's Appointment. Joining us is Mr. Lloyd McBean, who actually suffered a stroke over 2 weeks ago. Welcome, Mr. McBean.
Welcome.
2 weeks ago.
Yes.
Mr. McBean, tell us what was happening with you at that time.
Well, normally I do a little taxi work. I'm retired, so I'm helping out the children to school.
Right.
Basically, in the mornings, I would take them out and say about 9 o'clock, I would go home, have a cup of tea, have maybe an hour and a half rest, and then go back, say about 11 o'clock.
Right.
This day in question, I did the same thing and asked my wife to wake me about 11:15. But something happened, I awoke, and I don't know if it's the strokes that woke me or me was awoken first, but I felt my hand numb, my foot numb, and my wife realized that I was talking not correctly. But I stumbled to the kitchen to get some water to drink. And my way back, I had to keep holding on to things in order to get back to the seat.
Yes.
That time she get alert and she called my daughter.
Mm-hmm.
And she in turn called my son. And they coordinate from there. I was privileged that God just looked down and says, not your time yet.
Okay.
And allow me to go to the hospital.
All right.
Then from there.
All right, before we get to the hospital, do you have any medical illnesses that...
I understand I'm a hypertensive.
Okay, so you take medication for that, and
Yes.
you were taking your medication?
Yes.
When you got to the hospital, what happened then?
They rushed me to take a CT scan, all the necessary things for admission, my blood test, registration, and all of this was done.
Right, and when you went to CT?
And went to CT, they said that it was not a bleeding one.
Right.
It seemed that there was a clot. And I have to get some injection that will clear that up, and I will be normal. Well, I was waiting, and the doctor came in maybe about 3 o'clock, and I'm saying he has the thing to give me, and he said that there will be 2. One will be, and he just inject it into the IV.
That was already there?
Right.
So no additional...
And immediately I start feeling the hand different, because the hand was cramped constantly, and the cramping start dissipate, and the foot the same thing. So I said, I start feeling different.
Right.
So afterwards, I think they had the other injection into the IV and asked me wait for about an hour, and then sent me to the recovery room.
Okay.
Well, I was admitted now. I spent the night, which is the Friday night, and I felt I could walk the following morning. So they came to me to have me cleaned up, tidy.
Right.
So I told the nurse I can bathe myself, allow me to go to the bathroom, but they wouldn't allow me because of the experience I had. Right. So I told her, and I took the thing from her and fixed myself up, and called her when it's true. But the following morning, I was able to go to the bathroom and have my shower.
So you're cured from your stroke?
Well, bless the Lord.
Right.
He has been there with me, and I'm privileged.
You're watching Doctor's Appointment.
Viewers, we're giving you an opportunity to win a gift basket courtesy of water. Answer the following questions by liking our Facebook page at Doctor's Appointment and sending your response to our inbox. Fill in the blank. According to Peter Johnson, time is... Remember, first correct answer wins the prize.
Some things are scarier than cancer, like not being able to afford the treatment you need. You can't prevent critical illness, but you can prepare for it with ProCare from NCB Insurance. Get coverage now up to $5 million for 9 major critical illnesses, including cancer, heart attack, and stroke. ProCare could be the difference between life and death. Text CARE to 772-6062 or call 1-888-MY-NEEDS.
This year, Doctor's Appointment has added a new and exciting feature. It is the Doctor's Appointment NCB Insurance Express Fitness Weight Loss Challenge. It's dubbed New Year, New Me 2017. They'll be guided by the Express Fitness experts. These consultants will be there with them throughout the 12 weeks, working with them on their meal plans, their training programs, and these contestants can expect to experience the best 12 weeks of their lives, just getting healthy and staying healthy.
Not quite there yet. Now we're getting somewhere. This will put some pressure on it. Almost there. And just like that, 2.4 liters of water lost. So why not put back what you lose? Optimal dosage, 4 bottles for women and 5 for men. Don't just look at me, you're losing it as we speak.
4 a day, the water way.
Welcome back to Doctor's Appointment, where we're having a very interesting talk on stroke and some interventions that we can do. Dr. Johnson, what a miraculous thing. How do you feel about things that are happening at UWI and the direction that we're going with stroke treatment?
I'm excited about it, and it's a significant move forward, right? And I'm very grateful to be a part of all of this, yes.
Okay, so when Mr. McBean came in, though, we've been emphasizing throughout the time sensitivity. Is there any contraindications to someone getting TPA? And
yes.
Can you ascertain this in this short window of time?
Certainly. So one of the things that the emergency medicine doctors will be doing when the patient comes is to assess for contraindications, and that's what that means. Things that would preclude you getting it. The major one is that you should not have any ongoing bleeding, right? Bleeding from your mouth, from your rear, gynecological bleeding. If you've had any recent head injury, some people may have allergies to the drug as well. So the doctors would go through all of these things to make sure, but the main one is that if you have a current hemorrhage or ongoing bleeding or recent bleeding or anything that
or
would...
any disorders of bleeding.
Any disorders of bleeding as well.
You can't take the TPA.
Right, it will be dangerous in that setting, because one of the complications of it obviously is that if you're disrupting clot, right, you're breaking down that clot, your patient is now going to be at risk of bleeding.
Right.
And it is a complication of
it. So it affects your ability to make further clots as well.
Another, exactly. Well, not entirely, that's what anticoagulants are for. Usually they're put on aspirin and things like that. I should also mention that if you have a large infarct or a large stroke, meaning a large portion of your brain has infarcted, right? That is a relative contraindication for 2 reasons. One, the whole mechanism of how stroke works is that if you've cut off the blood supply to the brain, what essentially happens initially is that you have 2 zones of injured brain, a central area called the core, which is already dead, but there's usually a much larger area of salvageable brain, and that's what we're trying to save. Now, if the core is large already and there's not much salvageable brain, then there's no point giving it. So those are some of the things that we would look for.
Okay, and for persons like Mr. McBean or persons in the future that will benefit from this procedure, what is the pre or the post-procedure follow-up like?
So the post-procedure care is the same for all patients with stroke, and it's twofold. One is to support the patient, and in supporting the patient, it includes rehabilitation. So you're trying to get them to use or recruit various muscles that may not have been involved to help them to cope with any deficits that are there. Some patients who will have thrombolysis, this treatment, the TPA treatment, will still have some deficits, and they may therefore require some physiotherapy. And then the second but very important part is looking for the causes and treating them. Often a lot of patients may not know that they're hypertensive, some may not even know that they're diabetic. If these are things that are just recently found, then you have to start the process of managing them. Looking for the sources of clots in the case of thrombotic stroke. So you're going to do what's called an ultrasound of the neck, a carotid Doppler, you do an echocardiogram of the heart, you may do other vascular imaging. If people, there are a subset of people who have inflammation of the blood vessels, such as vasculitis, so you do what's called a collagen vascular screen, things like that. So you basically investigate the patient for the causes and manage those things.
Okay, and let's speak about a hard topic. Patients are present most often outside of that window, or some patients that unfortunately don't qualify or cannot afford TPA. What would their management look like?
All right, let me just jump in on one thing, the afford part. This is a difficult topic, but as far as certain as I'm concerned, we have to have things in place to ensure that that's not a reason why somebody does not get TPA.
Agreed.
If you cannot get TPA because of a contraindication or you just present late, in other words, say a patient is at home and they're discovered with a stroke and you have no idea how long it was, still get the patient to hospital. There may be things that can be done for them. Or even if you know that it's beyond that time, still get them to the hospital. There's no benefit of keeping the patient at home, right? Because there's not much you can do for them there. There's not much you can do that a general practitioner can do in his office for them as well. He's going to send the patient, he or she are going to send the patient to hospital because that is the management of these patients.
Okay, finally, Dr. Johnson, just a take-home point about stroke and management of stroke, what patients should look out for, what they should do, and what they should expect.
Well, stroke is not a death sentence, so to speak. It is not a inevitable disability, right? It's something that is treatable, and it has been treatable for some time now. But very importantly, time is brain. If you want to save those brain cells that are being injured during the stroke process, you need to get to treatment very quickly. And that time, remember, 3.5 hours, that is the most important time period. Patient who is losing consciousness, patient who has one side of their body becoming weak, slurred speech, facial twisting, severe headaches, all of those things, just get them to hospital right away. The medical team that's there will sort out everything at that point in time.
Okay, thank you very, very much, Dr. Johnson, and congratulations on all the work that you're doing. And we look forward to hearing big, big things from you.
Thank you very much. It was my pleasure being here.
Stroke is not an automatic death or disability sentence. The important thing is to act immediately. If you feel like you're having a stroke or witness someone who looks like they're having a stroke, seek treatment immediately. Remember, time is brain. See you next week on Doctor's Appointment.
Brought to you by Maverick Communications, NCB Insurance ProCare, NCB, Gleaner, Star, Singer, Spanish Court Hotel, Flirt Boutique, and Express Fitness. Aired exclusively on TVJ.